You actually wrote an open letter to Paul Ryan telling him it's time for him to step down. My guess, though, Autry, he probably didn't respond. What did you say to him?
No, my letter was real simple. Paul Ryan, the congressional Republicans don't believe in first principles. They don't adhere to first principles. When I look at the solutions they've offered for healthcare reform, when I look at the solutions that they're pushing Donald Trump towards tax reform, my principal problem, Dr. Gina, is they don't start with a conservative principle. That conservative principle that government should be limited and as far removed from the healthcare marketplace or from your money as much as possible. There are ways, and I'm working on a new column, hopefully I'll have it out in the next couple of days, but there are ways to be able to provide a safety net to deal with pre-existing conditions with the principles of limited government and free market. But Paul Ryan and the congressional Republicans, including now the so-called Freedom Caucus, just won't do it.
And so when you talk about pre-existing conditions, they would have us believe, Autry, that people were dying in the streets prior to Obamacare. That was never happening. No one was ever deprived care. It was more about the insurance, right? And so what you end up with, and the part of this bill, frankly, that even some so-called conservatives are complaining about, is they're really talking about people who ignore their personal responsibility to get some sort of health insurance, right, or some sort of coverage, and then they have some sort of catastrophic issue, and then they want the insurance companies to be forced to pick them up. The problem is that insurance companies, like anything, are a business. And if they don't have coverage prior and they've never paid in, they're not going to cover them. But anybody who was already paid in, had already been a member, and then encounters a bad situation, they were going to be taken care of. But even then, Autry, these things were always covered by emergency funds and hospitals, by all sorts of charities. Why can't we just return to like good old-fashioned personal responsibility, medical self-coverage?
But in fact, I agree with you, and that's what my article, my new column is going to argue, is that there's a way to set it up so that we can return to good old-fashioned self-coverage. But unfortunately, Dr. Gina, the real hard facts are, no matter where you and I sit, most of America actually doesn't sit that way, because Medicare, Medicaid, the federal pension system, Social Security, we're used to governments taking care of our health care. And so, unfortunately, if you look at, I think Pew did a study, Gallup did a study, 60 to 67% of Americans want some form of government health care, particularly when they reach 55 or older.
Yeah, but here's the problem. Here's the problem, Autry. It's like Margaret Thatcher said. At some point, you run out of other people's money. At some point, yeah. I mean, right? Either that or you become ruled by tyrants, because you have to hand everything over to the public domain and socialize virtually everything. And it seems as though healthcare at this point in the mentality of America has become an entitlement, even to most Republicans. Don't you feel like the re-education needs to start there?
I do agree with you, and in part of what I'm going to propose with regards to healthcare in my system is that if we basically set up a system that's graduated, so the poor of the poor get the help they need, and then you have like a graduated voucher or something similar, then we can do that. We can start to begin to recycle and make people responsible for their own care. But in addition to that, the AMA itself, the medical guild, needs to do some reforms. They need to open up telemedicine. They need to address and open up direct primary care. There's a lot of things that the medical guild, frankly, doesn't want to do because they want to keep the insurance money racking in.
Yeah, and you make such a great point. The American Medical Association are a bunch of crooks, frankly, with a very strong, well-funded lobby, as are the hospitals, who don't want their actual infection rates and other sort of transparencies ever published, along with the doctors who don't want anybody to know. They don't want you to be able to rate them as a consumer of their product. Those things need to change too. The problem is their lobby is so strong in Washington, D.C. that many of our legislators are bought and paid for.
Yeah, and so that's what I've designed. I'm going to send it to you when I finish it. But that's why I've designed this proposal. And there's more details that are going to be missing because I'm designing for mass consumption. But I've designed this proposal so hopefully it could get AMA buy-in, it could get insurance company buy-in, it could get everybody to buy in. But gradually what it will do, it will wean us off the notion that the fellow taxpayer owes us something and has to cover everything that we do. That's where we have to move away. Because if we don't, we're going to end up with single payer, and pretty soon, sex reassignment surgery is going to be mandated. And in some cases, I think there was a court case recently where they're already saying it should have been mandated.
Well, and don't forget our military, where we're having to pay for that already. Okay, but here's the thing. Yesterday, Dr. Carson mentioned that for his new 2 policies that he liked for HUD, now that he's running things, are that, hey, you know, we don't want to incentivize, we don't want to make the low-income housing too luxe, right, Autry? Because then you teach people to be dependent rather than to bootstrap it, right? You really create a different sort of a plantation, which is what Democrat policies have done. But not only that, he said, hey, if we're going to build these houses, how about the people that are going to live in them help us? And oh, the outrage from the left. Do you really think we can go back to the moments of real self-reliance like we used to have in America?
Well, I do think we could. With HUD in particular, I actually have an idea for HUD. What we should do is instead of handing out some stuff, make a database, make a central database of all the charities and churches that give money and have free housing and have help. And the first thing that happens when you come to government for help is we search the database. We search private charities and places and get in touch with them and have government liaisons that coordinate between private charities and the individual who needs help. And then if we cannot find you help, the taxpayer will come in and help. I think that would be a marvelous system, we would begin to revolutionize how we do government.
And I mean all due respect to you, because I could not agree with you more, but you think that because you are not a socialist and you are not a communist. And I remember thinking it was crazy to think that our politicians, even some on the Republican side, are so ingrained with socialism and communism that they don't even know it when they see it. But it's true, Autry. Most people, they don't even, you can't control people when neighbors and families and charities take care of people, because those organizations, those groups have to look them in the eye. Government never does, and that way government can control them.
Yeah, no, you're 100% right. And another thing about charities that I found out.
Almost out of time, sorry. Go ahead, quickly.
No, go ahead. I understand. There's nothing quick. Thank you, Dr. Gina.
You're the best. I enjoyed you. I want to have you back soon.